There is no conflict here in Carnot. There is no drought or famine. For the most part, people here live a peaceful life. So why are they suffering from what has been called a chronic health emergency? One of the explanations is the economy. Carnot is dependent on money raised from small-scale diamond mining. But Luc Fagende, who repairs clothing outside a former diamond exchange, says people starved when many foreign diamond companies left in 2009.
Before,
the foreigners came here to do their shopping, but now they're gone, and there's nobody here. There's no money to buy drugs to cure our sicknesses, and we've become very poor.
The medical aid group Doctors Without Borders, known by its French initials MSF, says Carnot suffers from a child mortality rate 3 times higher than the emergency level and elevated rates of HIV and tuberculosis. The head of mission for MSF France, Serge St. Louis, says the group set up a project in Carnot in 2009 to tackle malnutrition and decided to stick around to work with the health ministry to address the other health problems.
At the moment, you just step. You just put a foot in the hospitals, in any hospitals outside of the capital, you just find needs, big needs. Population that has no access because no medical personnel in quantity and in quality in those hospitals.
MSF says the biggest problem is that people in remote areas of the country have little means to get access to health care. Money is the first obstacle, poor infrastructure is another. Oliver sells medicine on the side of the road. He says the government needs to make a basic effort to help the people of Carnot.
After all the events in our country, we need to start repairing the city. And we need 3 things: health, roads, and water. With these 3 things, there will be no problems.
Pierre Dotwa has been the mayor of Carnot for the past 12 years. He says people here often complain, but that the government is doing what it can.
They are used to having money from diamonds. There are the lazy people, the people who don't make an effort to find other opportunities in other domains. But there are also others who get by, who manage to live. You have seen, there are nice houses in town.
Carnot is just a small example of the kind of health emergency facing the Central African Republic. Some areas of the country, still plagued by conflict with armed groups, are even worse off. Without more involvement from the government and interest from the international community, conditions are unlikely to change anytime soon. Gabe Joselow, VOA News, Central African Republic.